Health units are seen as a lifeline. When Brisbane's Barret Adolescent Centre closed, families warned that the consequences would be devastating, and they were right. Within 8 months of its closure, 3 teenagers were dead. Today, a commission of inquiry found that the former Newman government's decision to close the centre was ill-considered, as Kathy McLeish reports.
Justine Wilkinson has had enough.
I'm packing up my house because I'm leaving. I didn't even get upset.
It's almost 2 years since her daughter Caitlin took her own life at their home.
I'm leaving Brisbane because I'm not really getting any better and I can't work anymore at my old job and I'm not really fit to work.
Caitlin had battled severe and complex mental illness for most of her teens.
It was an agony. Every day is an agony that you wonder how you're going to get better.
The 18-year-old had been a patient at the Barret Centre, Queensland's only long-term residential mental health facility for adolescents.
They have to have hope. That's what keeps them going. And for all its faults, that's what Barret gave them.
But the Newman government scrapped a plan to replace the ageing facility and subsequently shut down the centre in January 2014. Within 8 months, Caitlin Wilkinson Whittaker was dead.
She just reached a point where she really just didn't want to go on any longer. It was just too much pain. So we lost her.
But she wasn't the only one. The Barret Centre was a lifesaver for desperately ill teenagers and their families.
You go to bed of a night time and you don't want to fall asleep. You're just always on edge, waiting for the next thing to happen.
For Nicole Pride, the centre was a last resort for her mentally unwell daughter, Talia.
So that's when we fought hard to get her to go into Barret, because I thought that was the last chance I had of keeping her alive.
When the centre closed, 17-year-old Talia was moved to an adult unit.
They told me they'd never dealt with a person this young with these mental illness that she had, and she was only there 8 weeks and she passed away.
So they went to Barret. When they were a suicide threat, they were actually monitored 24 hours a day, always in contact with one staff member that was dedicated to them. So it was really intensive treatment.
Joe Oliver's 18-year-old son, Will Fowle, was admitted to the Barret Centre a year before it closed.
Relieved, absolutely relieved. And yeah, I suppose I'd been running on stress for so long. It was just overwhelming that there is that help and support out there.
When the centre closed, Joe Oliver said her son was lost.
He went from his lovely support with the Barret, with the teachers, the counsellors, the psychiatrists, the nursing staff, all the other kids, having a whole lot of activities and being engaged and everything, to him being with strangers in a unit.
Will took his own life 5 months later. An ABC investigation revealed there'd been multiple warnings in the lead up to the closure. The government's advice, obtained under right to information laws, showed its own experts had considered a Tier 3 residential facility like Barret was essential.
The families, along with the centre's staff, the community and other families impacted by the centre's closure, deserve to know the truth.
The Barret Adolescent Centre Commission of Inquiry.
When the Palaszczuk government came to power, it established an inquiry to investigate the closure and its impact on patients. Today, that inquiry found no one took responsibility for the decision to close the centre. The LNP health minister at the time was inadequately advised, and consultation with Barret families was not ideal.
The report describes flawed, chaotic and uncoordinated decision-making by government in an environment where no one took responsibility or accountability for the decisions that were made.
The design-specific, clinically staffed, bed-based service was essential for adolescents requiring medium-term care and rehabilitation. That advice was not heeded.
The Commission also recommended the government consider a new building to provide bed-based mental health services to young people.
We will work with the families of the patients and consult with them extensively on the new facility.
For me, it's a milestone that's involved with certainly looking forward to the future of all the young people who are left.
But the Commissioner found overall individual patient transition arrangements at the closure were adequate.
I think they were doing it as best they possibly could under the circumstances.
The coroner will now consider the report. The opposition says the funds spent on the inquiry would have been better spent on youth mental health. Parents say their quest for answers is not over yet.
I just don't understand that, because Talia was transitioned out and she only survived for another 10 weeks and then she was gone. So I don't know how it could be adequate.
It wasn't adequate at all, not at all.
What's really important is that the government now acts without delay to implement those recommendations. However, the recommendations don't change the fact that families have been absolutely devastated by the mismanagement of care which surrounded the closure of the Barret Centre.
The Public Service Commissioner will advise whether action should be taken against any individual, and the results of the independent reviews will be shared with other states in an effort to improve youth mental health services nationwide.
I'm happy that they might be moving forward and helping other children and other families so they don't have to go through what I went through. But, you know, I'm grateful that they're moving forward, but I'll never move forward.
You know, it's just so pointless, and that's what really destroys me. I just feel so incredibly desolate all the time and so devastated that I've lost my daughter for such a stupid reason as saving money and somebody's agenda.